Hi, we will explain about a disease known as cholecystitis. What is cholecystitis? Cholecystitis is gallbladder inflammation. This occurs when the cystic duct, drainage pathway, of the bile contained in the gallbladder is blocked, the gallbladder is swollen and can become infected. It normally happens because several causes of cholecystitis. First, gallstones, the result of hard particles that form in the gallbladder. It may block the cystic duct through which bile flows. When gallstones block this tube, bile builds up in the gallbladder, which causes irritation and pressure to the gallbladder. It can lead to swelling and infection. Second, tumors. Both cancerous and non-cancerous tumors in bile ducts will cause blockages. It will prevent bile from draining properly from the gallbladder. Bile will build up, which lead to cholecystitis. Third, bile duct blockage. Kinking or scarring tissues of the bile ducts can cause blockages, which also lead the inflammation in gallbladder. Next, the fourth, infection. AIDS and certain viral infections can trigger gallbladder inflammation, while bacterial infection can occur when chemicals in the trapped bile, which may contain bacterial infection, can then lead to inflammation of the gallbladder. Fifth, blood vessel problems. A very severe illness can damage blood vessels, which will reduce blood supply to the gallbladder. This may happen to the person which diagnosed with diabetes. Sixth, gallbladder sludge. It is created when bile remains in the gallbladder for too long. Gallbladder mucus that mixed with cholesterol and calcium salts combine to form sludge. This thick substance no longer can be absorbed by bile. Gallbladder sludge appears to be more common during pregnancy or for people who have had a very rapid weight loss as they following to a strict diet. Next, we will move to signs and symptoms of cholecystitis. One of the main symptoms of cholecystitis is severe pain in the upper right-hand side of your abdomen. And this pain also can spread towards your right shoulder or back. The affected part of the tummy is usually very tender, and breathing deeply can make the pain worse. For some people, they may have additional symptoms such as nausea, vomiting, fever, jaundice, and sweating, and it different for each people. One more thing, usually all of these symptoms occur after a meal, and in particular when fatty foods are eaten. That's all for the symptoms of cholecystitis. Now, let's move to the next part. Moving on to real-life cases of cholecystitis. Usually, patients with cholecystitis will be diagnosed with imaging studies such as computed tomography, ultrasonography, magnetic resonance imaging, and nuclear medicine tests. However, this method lacks accuracy, especially in cases of a calculus disease. From a study titled Clinically Diagnosed Cholecystitis, a case series, 4 cases have been examined with patients from various age groups presenting symptoms of cholecystitis. Let's dive deep into the cases. The first case is a 28-year-old female presented with abdominal pain, nausea and vomiting. Physical exam detected right up quadrant tenderness. Workup such as abdominal ultrasound, computed tomography, HEDA scan with cholecystokinin, all resulted negative. Moving on, a 49-year-old female, with history of right up quadrant pain, nausea and vomiting. Physical exam exhibited epigastric tenderness and positive Murphy's sign. She underwent workup like ultrasound, CT abdomen, CCK HEDA scan, endoscopy and MRCP, which all normal. The third case involved a 52-year-old female presented with 6 months of epigastric pain with radiation to the back. She reported some pain associated with meals but inconsistently. She underwent ultrasound and CCK HEDA scan, which both resulted normal. The last case, a 54-year-old female with history of abdominal pain and nausea. She reported recent pain associated with Italian meal, but noted that she did have pain unrelated to oral intake. She underwent ultrasound, CT scan, CCK HEDA scan, which were all negative. All 4 patients underwent multiple imaging studies, which yielded negative results. But, due to persistent symptoms and pain, the decision was made to proceed with cholecystectomy, a surgical procedure to remove gallbladder. Each patient underwent uncomplicated cholecystectomy, continued symptoms-free 6 to 10 months after surgery. Based on the study, the hypothesis came out that cholecystitis is primarily clinical diagnosed, and physicians should rely on history and physical exam, regardless of imaging studies. Negative imaging studies should not influence the management in a patient with signs and symptoms of cholecystitis. Next, what is the treatment for cholecystitis? Treatment for cholecystitis usually involves a hospital to control the inflammation in your gallbladder. Sometimes, surgery is needed. At the hospital, your doctor will work to control your signs and symptoms. Treatments may include: first, is fasting. You may not be allowed to eat or drink at first in order to take stress off your inflamed gallbladder. Next treatment is fluids through a vein in your arm. This treatment will help the patient to prevent dehydration. Antibiotics to fight infection is another treatment for this disease. If your gallbladder is infected, your doctor likely will recommend antibiotics. Next is pain medications. These can help control pain until the inflammation in your gallbladder is relieved. Another method is your doctor may perform a procedure called endoscopic retrograde cholangiopancreatography (ERCP) to remove any stones blocking the bile ducts or cystic duct. Your symptoms are likely to decrease in 2 or 3 days. However, gallbladder inflammation often returns. Most people with the condition eventually need surgery to remove the gallbladder. Gallbladder removal surgery is called a cholecystectomy. Usually, this is a minimally invasive procedure, involving a few tiny incisions in your abdomen, which is laparoscopic cholecystectomy. An open procedure, in which a long incision is made in your abdomen, is rarely required. And, most importantly, once your gallbladder is removed, bile flows directly from your liver into your small intestine, rather than being stored in your gallbladder, and you don't need your gallbladder to live normally. Last but not least, thank you for watching.